Hello, I'm Dr. Caroline Jouhourian. I'm one of the GI fellows here at Tufts Medical Center. I'm going to discuss my paper, Abdominal Compression During EGD Demonstrates Hidden Schatzki's Ring. As we all know, Schatzki's rings are mucosal rings around the esophagus that are also associated with hiatal hernias, are one of the most common causes of dysphagia to solids in addition to eosinophilic esophagitis. One of the major questions that arises from our paper is why did we care about this? Our interest in this topic stemmed from the fact that we had seen radiologists apply pillows to patients' stomachs during GI series to help diagnose Schatzki's rings. We were wondering why was that the case, and in fact what happens is that it actually reduces the hiatal hernia and demonstrates the Schatzki's ring, thus helping their detection rate. What we thought might be of interest is the benefit of endoscopy is not only does it diagnose, but it also treats a limitation that we often see in radiology. So perhaps if we could find a technique that helped us detect Schatzki's ring during our procedures, we could also then treat these patients accordingly. As we know, most of these patients who have dysphagia to solids are often referred to us without proper radiographic studies, and we have them undergo EGD, and without a diagnosis of a Schatzki's ring, they undergo an empiric dilation. So one of the benefits of our paper is that perhaps if we can detect these Schatzki's rings, then we can treat these patients properly and hopefully help with their symptomatic improvements. So one of the ways that we thought about doing this is that, if we detect the Schatzki's rings, we can dilate them with larger dilators than typical when we do them for patients who do not have this diagnosis. But additionally, we can also have them undergo ablation of these rings. This was demonstrated by Gonzalez et al. In diseases of the esophagus, and this really requires using large forceps biopsies and taking about 10 to 20 bites of the ring and hope that this will treat their dysphagia to solids. So one of our thought processes is that perhaps in the future we can look at whether or not the detection rate of Schatzki's rings helps also with the clinical improvement of these patients. One of the limitations of our study was that it was actually a retrospective study where we didn't actually follow these patients long term. So we weren't sure whether or not the diagnosis actually helped with these symptomatic improvements. In the future, our hope is to potentially have a control group where we look at patients who don't have a diagnosis of Schatzki's ring and undergo empiric dilation. Have another group that has a diagnosis of the Schatzki's ring via our technique and undergoes dilation, and then have a third group who also has a diagnosis of Schatzki's ring and undergoes ablation as described previously, and assess whether or not long-term which group actually has the clinical improvement that lasts longer. Another potential aspect of our study is in the future, a question that may come up is what should we do with the patients who we don't diagnose as Schatzki's rings? Do they actually need to undergo empiric dilation, or should we actually look for other causes of dysphagia, assuming that we've ruled out other causes such as eosinophilic esophagitis? So those are directions that we're looking for in the future and hope to proceed with and help with the management of these patients who have dysphagia to solids secondary to Schatzki's rings. I'd like to thank my colleagues, Dr. Moses Gelrud and Dr. Peter Bonus, for helping me with this paper. In addition, I'd like to thank Tufts Medical Center for their support in the process. Thank you.